Following reversal, a very common question that we receive is, how can I optimize my chances to achieve a pregnancy? Well, this is a great question, and we'll discuss it by breaking things down into 4 different categories. The male partner, the female partner, timing, and then other. So first, the male partner. Well, there are several different things you can do to optimize your sperm production overall. This includes maintaining a healthy diet, exercising regularly, keeping a routine sleep schedule, avoiding marijuana, limiting alcohol, tobacco, and other similar drugs. Now, the optimal diet isn't really known, although there are several studies which suggest that a Mediterranean diet, such as the use of nuts, fruits, vegetables, and healthier oils, is probably better than a more traditional Western diet. There are also some studies which suggest that a daily multivitamin and other supplements, such as coenzyme Q10 and L-carnitine, may be of some benefit. However, it's important to realize that while all of these measures are good, they likely will only have a very small impact overall, if anything, particularly in the case of a vasectomy reversal. The reason for that is because with a reversal, the main issue is blockage rather than the actual production of sperm. So next, the female partner. Now, in contrast to the male side of things, the female partner health has a very significant impact on the ability to achieve a pregnancy. Whether it's obesity, poor diet, lack of exercise, advancing age, and irregular sleep patterns, each of these can significantly impact the ability to achieve a pregnancy. Now, don't get me wrong, I'm definitely not a specialist on the female fertility side of things, but optimizing health, and in particular maintaining a healthy body weight, can have some of the biggest impacts on being able to achieve a pregnancy overall. Now, I agree, it definitely doesn't seem fair, but overall health has a much bigger impact on the female side than on the male side of the equation. The third category that we'll go into is timing. Now, in addition to the female side of things, timing is absolutely critical to being able to achieve a pregnancy. In fact, ideally, you want to start trying to get pregnant as soon as the first month after surgery. Now, some people have asked if this increases your risk for having a baby born with chromosomal abnormalities or other similar things, and the answer is no. The currently available published data do not suggest any higher risks if you get pregnant early versus late after reversal. But in contrast, I found that typically there are 2 periods of time when people are most likely to get pregnant after reversal. Either it's in the first few months or it's about 1 to 2 year time point later. And although some people get pregnant in the middle, it's less common overall. So what that generally means is that beginning right after surgery, you should save up ejaculation until the day prior to ovulation, and at that point you should have intercourse the day prior to ovulation, day of ovulation, and then day after ovulation. Now, if you're not sure when you ovulate, or if you have very irregular cycles, you can use these ovulation predictor kits. Otherwise, you can download apps that will allow you to track your cycle. And all of this is talking early post-operative, so you still need to be very careful. If you can't have intercourse without pushing on the scrotum, in that case you can ejaculate into a cup and instill it using a 10 ml syringe. Now, I know that seems very medical, but it can be very effective. This can also impact when you plan to have the reversal. Ideally, you want to have the reversal at a time when you're planning to get pregnant. Some people will wait 1 to 2 years before they're ready to achieve a pregnancy, and the problem with this plan is that in about 15 to 20% of cases, a successful repair will later close down and not open up again. So this automatically decreases your overall chances for success a bit. You want to take advantage of as many of the early months as possible, but once you're outside the first 2 to 3 months, you ideally want to have daily intercourse beginning 5 days prior to ovulation and continuing for 1 to 2 days thereafter. Now finally, there are many other potential factors to discuss which can impact pregnancy rates. Medications, supplements, and other therapies, such as prednisone, NSAIDs, ICE, serrapeptase, Clomid, HCG, and others are all therapies which have been used by some to enhance fertility. Many of these don't have any evidence for benefits, and some can actually be harmful. You may want to see our other videos on prednisone, NSAIDs, and Clomid for more details here. Since each of these is a very long topic, those other videos will go into greater detail. One thing you should definitely do, though, is remain off of any muscle-building substances, as anything with testosterone or something similar will impair fertility and could reduce your chances of achieving a pregnancy. We hope this video has been helpful to you overall. We recognize how stressful and challenging this part of the process can be, so feel free to reach out if there's anything we can do to help. Thank you very much.